So we all know that prevention is better than cure.
Yes.
So if we know something that's happening, then it's more important that that person start taking some actions lah.
Hello, everybody. Welcome to another episode to Chit-Chat with AuntyHR. Today, I have a special guest that is going to educate us on what is very, very important in our lives. Health benefits. It's a subject that is so important and it's very close to my heart. Nanti lah, I introduce him first, then I share you all my horror story when it comes to health benefits, okay? So today with me, I have Mr. Ho Mun Kiat. He has more than 20 years experience in the health benefits industry. And currently, he is the managing director of Mercer Marsh Benefits Malaysia. Welcome, Mr. Ho.
Thank you, Auntie.
He's so excited to see you finally.
Same here.
I was a Marsh customer for many, many years,
Thank you. Nice to hear.
Always been very supportive. Anyway, so to kick things off, why don't you tell us a little bit about Mercer Marsh? What I understand, you guys are a broker.
That's right. So Mercer Marsh Benefits is basically a collaboration of two organizations. So Mercer is a HR consulting firm and Marsh is an insurance broker. So we provide both consultancy on benefits plus insurance broking as well.
Oh, it's a HR consulting firm.
Yes. Apart from just benefits, we do compensations, we do salary reviews, benchmarking.
That's
Yeah.
right. And then with Marsh together, so you guys are more focused on health benefits.
That's right. Yeah. So on the Marsh aspect, it's obviously, if you know, the Marsh is actually an insurance broking license with the central bank. So I think that's where we do the insurance placements through the Marsh licensing.
So you guys would represent like multiple insurance brands, right?
We do, yeah. So we are not an insurance company. So wherever clients come to us looking for solutions on their insurance, we represent every insurance companies because we are a licensed broker.
And insurance is just one of the product that you guys
So
help with.
insurance benefits is just one of it. So we do
Yes.
also provide like benefits review, benefits benchmarking, a whole suite of other things which our clients are looking for. So we do provide that as well.
Which is all related to employee benefits.
That's right.
That is interesting.
Mm.
So we are here today to talk about your recent report on Health on Demand 2025,
Right.
which is a global report that you
Yes,
guys produce
that's right.
every 2 years.
Yes, that's right. So every 2 years, we run a health on demand survey, which focuses on employees. So where we find that a lot of our clients are looking obviously from two lenses, right?
Yes.
Obviously from their view, and they also want to know what are employees looking at benefits,
Yes.
looking at health, and also at different demographics as well.
I read your recent report and the latest one that you guys conducted last year, right? Which is published this year. You
Yeah.
have more than 18,000 respondents
That's right. Yes.
across 20 markets.
Yeah, that's right.
Ah, and then one of the very interesting finding that I saw is medical inflation. That one, I also kena, okay? Because I saw that the average medical inflation right now is around 15%.
For Malaysia, yes. Yeah.
Very steep.
It
Our
is.
increment is only 3 to 4%.
Yes. Easily 4 to 5 times of the inflation rate. And I would say that we compare Malaysia across other regions. We are also one of the highest in Asia and also across the world as well.
Is there a reason why it's so expensive in Malaysia?
So there are a lot of things that's affecting inflation increases on medical. Obviously, one of those things is the high utilization. So a lot more people uses the medical. So utilization rate is pushing up the overall medical inflation. Other things like medical advances. So like those days appendicitis, it just costs like 3,000-4,000, right? If you go and go to hospital today, right, appendicitis costs you like 15 to 18 to even 20,000, right? So that's the reason why we see medical cost increases.
Yes,
Advancement in medical sciences and things does exacerbate and push up the overall cost as well. And in Malaysia, we all talk about it. We are in an aging population. So when people start age, consumption of healthcare increases. So I think that's all these factors are add together. That's where we see the medical inflation moving a lot higher than what
Is
we have been
that why the
expecting.
older we get, the higher our premium is?
If you're looking from an underwriter's perspective,
Okay.
then yes, because obviously the older you get, the more probability for
Expenses.
you to use healthcare is obviously
Yes.
higher. So I think that's where the insurance concept is all about. When everyone goes on insurance, then the younger population basically dilutes the overall risk. So I think that's why when we look at group insurance, you see that the premiums are a lot more competitive because you have the younger populations covering the overall risk lah, basically. But yes, so if you are a single person going to purchase insurance at certain age, like 40, 50, 60 years old, then your insurance premiums will be a lot higher.
But we talked about it before we started the podcast, right? Gen Z nowadays don't believe in it. Even now, we talk to our Gen Z in the studio, they also like, insurance, what insurance? But they don't realize the later they wanted to get it, which they
Yeah.
wanted eventually,
Yeah.
it's going to get more expensive.
Yeah. So one of those things that we do, some of the surveys findings that we found
Mm,
was
mm,
if you ask employee what are the benefits,
mm.
and a young person, especially in the younger population or the Gen Zs, they find it, oh, my company provides me with group term life, medical, but whether it's something meaningful to them, it's another question because recently we just did a focus group with a large organization and we asked the young people group term life and they said, oh, okay, what is it, right? So group
Mm-mm.
term life is basically a very important benefit because it covers you. If something happens to you, your dependents gets the sum payout, right?
Or even if they have partial
Correct.
disability, total
That's right.
disability.
You get some lump sum payout to
Yes.
so that your dependents can survive on certain.
Yes.
Yeah. But the young people were thinking, oh, it means something happens to me and my parents get the money. And they say, Mr. Ho, what is that a benefit to me, right? My parents are richer than me, that kind of thing. So exactly. So I think this is where from the health of demand, we see where every organizations now have easily 3 to 4 generations working in. You've got the
Correct,
Gen
that's
X, the
right.
Gen Y, the Gen Zs, and soon we get the Gen A coming in. So you have got one organization with so different diverse
Mm-hmm.
generations. How do you make benefits a benefit? Yeah.
You talking about that, your report also show that 60% of the respondents are caregivers,
Mm,
which means they are somehow responsible taking care of either a child, spouse, or their
that's right.
parents.
That's right.
So it's also a burden to
Yeah.
them when it
Yeah.
comes to health benefits.
Yeah. Interesting. This round of the health and demand, we found this is a staggering findings because
I thought it
yeah.
would be higher,
Mm.
60% so little, man.
Exactly because like the Gen X, Gen Y, and all that, I take care of
Kids
myself. I take care of my kids. Then I've got a parent who
that's
is
aging.
aging. I've got to take care of them as well.
Mm-mm-mm.
We call it like much like a sandwich generation lah. You
Yes.
got to so that's where we see one of the things that we saw in most results coming out from various countries is the mental health issues is increasing because people are getting more lot of stress. The pressure is there for me not just to take care of my kids, right? It's also to take care of my mom or my dad or some elderly person. So I think that's where there's a feeling a lot of stress level, not just financially but even the pressure to be there. So that's where I think it's really something that we saw that a lot of employees are actually raising up as an
Yes,
issue. Yeah.
since you brought up mental health issue, I also want to highlight one of the findings of the survey. It says that only 25% of the employers
Mm,
provide mental health screening,
mm,
where there was like around 38% of
mm,
the survey respondents said that they wanted it. So
right.
it's quite a gap there.
Yeah.
It's like as if the demand is higher than the supply.
Right.
But when I was reading the report, I also very curious. What is a mental health screening? What do you do to screen
Yeah.
our mental health? It's not like a physical body checkup, right?
That's right. That's
Eh?
right. So if I want to check physical health, right, if you just put a thermometer or I draw
Yes.
some blood from you, I know whether you have chronic illnesses or your physical health. But how do I know whether you're mentally well?
Mm.
We don't have a thermometer or something to check that, right?
Yes.
And the latest,
Like my boss pressuring me. How do you measure that by mental wellness?
so it's basically if you look at
Mm.
the latest survey from Malaysia, I think was the Malaysian Health and Mobility Survey.
Mm.
Easily about 30% of Malaysians are in some level of stress.
Yes.
So if you look at the room, right, out of 10 of us, 3 of them are basically either they are burnout, they're stressed, or even have suicidal thoughts as well.
I'm surprised it's so
So, but the
low.
question is, if you look at the room, how do you know? We come very normal, we breathe normally, we put on a straight face,
Mm.
right? But it's, in Asia, it's a stigma. I can't tell you that, hey, boss, I'm going through financial problems at home. I need a break. It is a stigma in Asia to tell people that you are going through stress. So people don't openly talk about it,
Yes,
but that does not necessarily mean that it's not there. So the
that's
the,
right.
the health assessment is basically some of these health wellness vendors. It's just basically about 5 to 10 questions. By
Mm.
answering these questions, they can tell whether what level of stress is a person in, whether they are close to burnout or whether they are facing very severe stress issues. It's just answering these two questions. Even easier, it's even painless than taking blood or putting you on.
So it's like an interview lah,
Yeah, it's
right?
just answering questions, and it can be very anonymous. So you can just send out everything through a mobile phone. You just click, 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 and then send through. And then, as an employee, you can see a dashboard, right? How many percentage of employees are at what level of stress or whether they are depressed, and then you can then start taking targeted actions to address those issues, which is kind of lacking.
That is
Yeah,
interesting, But what I know, right? I don't know. Like people, when I read from the survey, it looks like people are also craving for therapy sessions.
mm,
Like how do they manage their stress level? They
right.
are also looking for bosses with better emotional intelligence. But how does insurance come in to help? Because to my knowledge, it's not something that is very popular in
No,
Malaysia to
yeah.
cover.
One of those things that we have also as an insurance broker, also
Mm,
talking to a lot of insurance companies as well, is we know mental health is a big issue.
yes.
It's an issue that is there. It's
Mm,
underlying
mm, mm,
issue,
mm,
like,
mm.
basically. But why don't we have coverage for it?
Yes.
I can't buy a mental health coverage. Also because, going back to the same, what I spoke about just now was, I can't test, right, whether you're mentally ill.
Mm,
Whereas whether you're sick or not, I
mm,
just put a thermometer, come out, oh,
mm.
you're sick. I know. Confirm. I pay claim. But whether you having psychometric problem or psychological problem, I'll send you through a psychologist, right? I can send you to 3 different psychiatrists, and 3 can come up with different. You can say I'm not. You can say I am. That
Depending on the mood of
exactly.
me
So
that day lah.
so if I'm going to pay a claim, how I'm going to make the
Yes.
payment. So that's the reason why a lot of insurers are also shying away from this. But I can say that a lot of them are looking into some shapes and form
Mm,
of
mm, mm.
coverage on this.
I think the more acceptable assistant they're providing is this EAP now, which was
Yeah,
very popular during the pandemic,
that's right.
Employee Assistance Program,
Mm,
where they will ask people to come on a voluntary basis if they need mental assistance.
yeah. So EAP programs are one platform where
Yes.
employers can put up and get employees to call in. I think there are more things that employers are now doing, making sure that the environment at the workplace are less stressful, making sure it's more open. They must create that culture within organization to be openly to talk about it. And usually where we advocate is the leaders talk about it first. So even in where we come from in our workplace,
Mm-hmm.
leaders do share their stress issues openly. So if I'm an employee, I see my superior doing it
Mm,
and they're not shy with it, then I myself become more open to it because it's not a stigma anymore. People
that's
won't judge
right.
me because I'm facing problems at home or I'm facing this situation at the moment. People don't judge me because everyone taking it as normal. So they need to create that environment. We find that just putting an EAP program, it doesn't sticks because no one really want to pick up the phone and call. Yeah, it's really of encouraging an
That's
environment. If
right.
you start encouraging people to do that, then you will see more of these cases being surfaced, and it's good because that's where you're addressing the issue.
I'm an advocate about seeing a therapist.
Mm,
During my most stressful days, especially when I'm working, right?
right.
Because leaders are very lonely at the top. You
Yes.
you would know it for sure. Like when we have problems, who am I supposed to talk to? When we talk to the staff, they say we are demotivating, right? When we talk to our boss, they say it's not their problem, it's our problem. So we are also sandwiched in between as middle managers and as leaders. So always say the one of the best way is seek help ourselves.
Yeah, yeah.
Mm.
And I think it's very important that employers need to create that platform, the environment, so
That's
that
right.
if they want to come forward to seek help, there is avenue to do it. And while we're going back to the insurance portion, where even though
Mm,
insurance companies don't cover, because we know certain drugs on this can be
mm,
quite
mm, mm,
expensive,
mm,
but where we advocate is why not you put a cap. I'm not saying that you need to cover everything, like you cover hospitalization
mm,
bills.
mm.
You maybe put a very small cap. Maybe we start taking baby steps. Then we start going to see, because all you need as an underwriter, as an insurer, is you need to look at incidence rate ma, so you can calculate the risk ma. So we say why not we put in like a small little cap,
Mm, mm.
rather than say that, oh, we don't cover, or we don't touch it, we don't look at it, but then we're not helping everyone to get this in place, right? Yeah.
Yeah, you're talking about that. Anti-HR will bring out the law. Actually, in Employment Act Section 24(4), it does says that you can do a co-payment system.
Yes, that's right.
It's allowed as
Yep.
long as it benefits the employee.
Yeah.
So a lot of companies that I know, they also don't shoulder the full burden
Mm.
of purchasing
Yep.
an insurance, a group insurance.
Yep.
They can also split payment.
This is, I think, becoming more popular now, because
Mm-mm.
the rising healthcare cost is obviously pushing a lot of employees to start thinking, hey, maybe we need to start getting people to be more responsible, right? Because
I like that.
if you want to be a good parent doesn't give everything to their kids, right? You're literally spoiling them. A good
I
parent would
agree.
literally instill responsibility in their
Mm-mm.
children, how to be responsible when they grow up. Same goes to benefits as well, lah.
Mm.
End of the day, what we want to advocate employers to do is don't just give healthcare, right? What your employees need is health. Healthcare is you provide as a benefit. But the thing is, being overly provided, people look at it, oh, then it's your responsibility. I can continue to do what I want. Anything happen, zap, I use healthcare. But at the present stage, with 15% medical loss ratio, a lot of employees are now struggling. Then what do we do? That's where I can tell you the last 2 or 3 years, we've been having a lot of clients coming to us. How do we need to then revamp the healthcare to make sure that we instill a little bit of responsibility? Because end of the day, as an employee, if I put certain preventive screening in there, if I
Mm.
communicate it at the right way, we are actually helping employees to live healthier lifestyle. Yeah.
You know what? Now you bring the preventing screening issue up. I also read in your survey that only 15% of the employers are providing cancer screening,
Mm.
which
Mm.
is one of the leading cause of death.
Yeah.
In
Mm.
fact, in Malaysia, is the number 4 leading cause of death, and globally is number 2.
Yeah. It's going to hit even higher, we are seeing, because right, I mean, you look at medical sciences, we have already find cure for a lot of things,
Yes.
and no longer heart disease as one of the big, because they find a lot of things to actually prevent
Mm-mm-mm.
that. So that's why we see cancer cases coming out as one of the leading cause of death. Hitting now top 5,
Yes.
soon top 3 already. But the thing is, where is the screening, right? How do we keep people aware that
Yes.
you have got early signs of this? And we all know that if you discover something early, there are a lot of things you can do about it.
Correct.
Yeah.
Correct.
So that's where we also want to advocate. There are a lot of ways you can get employees to get screened. Why not you include that into your preventive benefits?
Yeah, in
Yeah.
fact, WHO also came out with surveys that said 30 to 50% of these cancer cases are actually preventive. And preventive screening measure is one of the way to do it.
Yeah.
Right?
It is. Yeah.
And then if they do this preventive care, probably the, what do you call it, utilization will not go
reduce.
push that far.
That's right. So we all know that prevention is better than cure.
Yes.
So if we know something that's happening, then it's more important that that person start taking some actions lah.
Actually, when I was using Marsh, I received that kind of report every month. But the question is, as HR, I don't have the time to look at it.
Yeah.
And if I give it to somebody more junior, they don't know how to look at it.
Yeah. So we do obviously do that. So obviously identifying where this bucket list is, and also that's where we always say that the well-being programs need to be a bit more targeted. I don't want to say something that which may offend your audience, but please forgive me. Say if you do like a Zumba or like a run, guess who come for the Zumba and who go for the run, right? The gym rats lah. Those who already doing it will do lah, right? No? Those who people like
Definitely not me.
Yeah, those who sitting in front of Netflix watching Squid Game, right? We probably won't go and do this kind of thing, right? So how do you move people who are not thinking about well-being, or not thinking about health, to start thinking and start doing something? That is the whole idea of making your well-being programs more targeted. I get it, right? So companies want to have a family day when you do run Zumba. That's fine. That's great. But don't label it as I've done well-being programs. Don't take it as that. That is more engagement level.
Ouch. But I totally get it. There is also something called a flexi benefit thing, right?
Yeah, yeah.
Hmm? Is it expensive to implement such benefit?
Not really, not really. So flexi benefits is going back to the point I mentioned earlier, where you have got multiple generations working in your organization, like a Gen Z. If you tell them you got medical benefits unlimited, you can go to clinics how many times they look. Oh, I don't even go to a clinic once a year. They may not appreciate it lah. But if you flex your benefits, meaning that, hey, if I don't use so much of medical, can I just buy less? You have an option to sell down and then use whatever you have to go and do something meaningful. For example, I want to go for holiday. I use the money to go and buy the latest, mobile phone or whatever. It's very, very engaging, right?
Yes,
So,
yes.
so this is what flexi benefits. It makes sure that your benefits provided, it's across every different demographics, so that the Gen X or even the more senior people can even use it to buy more. Maybe the benefit you provide to them is not enough, or group term is not enough, so they can buy more because they at that stage they need more. But the younger people may want to feel that I'm going to buy less. Yeah.
I will tell you
Yeah.
my bitter story when it comes to insurance. And this happened when I was young.
Right.
I was young. I have been having very bad sore throat for quite some time. So normally you have a sore throat, you will go to a GP to see a normal doctor, right? So diagnose, give you some lozenges, then discharge you. Then I started coughing and coughing, not getting well. Then I went to see another GP for second opinion.
Right.
Same thing. Because my company back then, they don't provide specialist care.
Right.
So I was hopping from GP to
To
GP
GPs.
to
Right.
GP. I was
Right.
being misdiagnosed, being
Right.
diagnosed until I collapsed and
Oh
I was
dear.
hospitalized. And when they checked, turned out it was bronchitis.
My
Nothing
God.
to do with the
Yes,
throat.
yes, yes.
It was the lungs. So I've been taking all this sore throat medication for
Right.
nothing.
Uh-huh.
But you see, but it happened because I was young.
Right.
And when young salary not so high, go to see a specialist is very expensive. And my company did not provide. They provide hospitalization care,
Right.
but not
Not
specialist
specialist,
care.
Right.
So if they would have provided me specialist care, company probably just had to pay 300 ringgit, identify it was a lung issue, instead of paying 15,000 to get it hospitalized. So I am a big believer of all this preventive care. Actually, that was how I found out I got high blood pressure.
Oh dear. Right.
It's
Right.
also medical screening.
But at least then you start doing something about
I
it.
started doing
Yeah.
something about it. There was the year that my company implemented a employee benefit on health screening.
Good.
They allow
Good.
us to claim.
Yeah.
So when I go check that time, they checked my BP. It was
Right.
160.
Oh.
Some more
Right.
the nurse can tell me, why don't you go relax, walk around, come back and for a second test. I go like, got second test one, I can test again. Like you fail your exam, come and resit. So I went around and rest, came back, it's still 160.
Right.
That was when I found out I got high BP. But it was preventive care. It was good. My company, they have this kind of benefit first. Then I started taking high BP medicine.
Correct.
To control it. Because apparently the number one killer for deaths is cardiovascular issue.
That's right.
And it's related to things like heart attack, stroke, which comes from high BP.
Correct. So that's where you see a lot of cases where some people just collapse.
Yes.
Because they are not aware they have this condition.
Yes.
Right? So I think that's very, very important that this sort of preventive is made available.
Yes.
So that people are aware and then they start taking actions to, if you can't reverse, at least maintain where you are. So I think that's where employees can do their part to drive health within the employees.
Actually, when you talk to a lot, especially for SMEs, they will think like it's a cost,
Right.
but they don't realize that all these health benefits are actually business enablers. They
Mm.
actually help retention.
Yes.
They actually get you to attract better talents. And then, of course, to maintain the well being of the employees, you will have more productive employees.
Yeah.
And that's no brainer about it. Lah. Actually, we also lost a lot of talents to companies because of health benefits.
Really.
True story. I remember there was one time we have a performer. She was doing so well, but she left us because she has a son that
Mm.
has some heart issue born
Right.
with it.
Right.
So medical bills are very high.
Okay.
In my company, we also provide insurance for family, but limited.
Right.
So she found another company that provides better family insurance. So she hopped because of insurance only.
Right. Right. Right.
So it's really a tool that employee use to attract talents.
Yeah. From where we come from Mercer Marsh Benefits, we look at total. We call it total remuneration, lah. Compensations and benefits you add together.
Yes.
So that's where when you start looking at your overall remuneration, it's just not just compensation, right? But also look at total remuneration because that's very important because
Yes.
employees do look everything at a holistic basis and just not literally looking at salary per se. Lah.
It's important lah. I feel it's very important. I still remember when I switched jobs that time. Coming from a large MNC to a smaller SME where they don't provide insurance, right? It made me pause for a moment, you know.
Right. Right.
Because if the company doesn't provide, means I have to go buy. And when I go buy, it will come out from my pocket. It's cost.
Yeah.
And of course, when you buy personal insurance, it's not, the pricing is much higher compared
Yeah.
group.
And you've got underwriting, you've got a lot of other conditions like pre-existing.
Yes.
And yeah, these things will come in.
So right.
Yeah. So especially when we present some things to the C-suites, the CFOs, they usually question like, hey, it's salary versus benefits, right? We know salary pays, salary attracts, motivates, and things like that. So where does benefits cost comes in? A lot of business owners will start thinking, does benefit motivate, attracts? Some don't, some do. But we feel that based on a lot of feedback that we get from employees, benefits is a hygiene factor. You can say that it doesn't really motivate very much, it doesn't attract very much, but if you take it away, it demotivates really. So it is a very hygiene factor. You need to at least put a minimum cover in place so that people feel that yes, there is something for me, rather than not even having it at all. Because it is a hygiene factor within the whole equation of your total remuneration.
That is such an interesting point of view. I never thought about that way.
Yeah.
While it might not be a big thing, but if you don't have it, it's a big thing.
Yes. If you pull it off, right, people will start feeling demotivated, shortchanged, or something is not there.
I so get it. Actually, I have a lot of followers come and ask me, Auntie, this insurance thing, is it mandatory by law? Unfortunately, it's not.
Yeah, it's not. But you think about it, firms that have that do see that the attraction and retention of employees are a lot stronger. So I think that's where even the data itself speaks for itself, really.
Correct. When going back to my earlier point, right? Actually, there's a lot of hidden costs that bosses don't see, like the cost of rehiring.
Yeah.
The cost of having unhappy employees, the cost of having burnt out employees, because the tendency to make a mistake that causes you loss of business is even greater. But I know a lot of HR, they also have challenges. When they present something to their management, right, they don't get it approved. I think a lot of HR tried. But I always see it's lack of data.
Yeah, lack of data, and that's right. So data is one thing that is very important.
Yes, to bosses, right?
To bosses, because that's where, from our perspective, and especially when you talk about flexible benefits just now, we have helped numerous firms get their flexi benefits approved, and many times we always sit in front of the CFOs to look at the cost projection, and we always talk about what is the cost of doing something and the cost of not doing anything. So you just have to use historic data to project the cost of not doing anything. versus the cost of doing something, you would see that the cost of doing something now over a long period of time will be much flatter than the cost of not doing anything. So the big questions back to employees is, can you afford not to do anything? So that's the big question they have to answer.
My brain is like blowing up right now. That is so deep, yet so meaningful.
Yeah, because we have enough data to show that if you don't do anything, where do you see yourself in 5 years' time or 10 years' time? And there was not a client that we have not broke even. That if you project not doing anything versus you start doing something now, no matter how minimum it is, you would definitely see an effect of doing something.
Because standing still can break you even further if you're not trying and failing.
Yeah. And it's important when you do something, then what is the something you want to do? Data is important. It means I need to hit that whichever percentage to give me the biggest outcome. Then that doing something will give you the enough results or ROIs to justify why you need to actually do it.
So where can they download this health on demand survey?
Actually, as our website, you can actually do it.
Marsh.com.
I can provide the
website. Okay,
yes,
we will put it on the comments later where you guys can download the Health on Demand 2025.
Yes.
Which I think has great data to convince
right.
bosses. If you don't do this, then if you will suffer greater loss by doing nothing. That was like the grand ending of this interview. Okay, Mr. Ho, before we wrap up, what advice would you have to business owners out there, especially for those who are still thinking, should I invest in better health benefits?
Yeah, so I think we all know employees are the greatest asset. I think of all employers, become a lip service lah. But end of the day, do we really put the money where our mouth is lah? We know that people are your greatest asset.
Yes.
You take care of them, they will take care of your business. And health benefits and health well-being are what your greatest asset needs. So I would really recommend that you need to start investing, no matter how small, into this to make sure that your greatest assets are taken care of.
Amen to that. Preach louder, preach louder. I think I totally agree. Employee is always the heart of the organization. You take care of them well, they will take care of the business well.
That's right.
Right? With that, thank you so much for coming
Thank
today.
you. My pleasure. My pleasure.
Hey, I also wanted to ask before we go, very important thing. Why must we buy insurance through a broker and not go directly to the principal?
Yes.
I always want to ask this,
Right. I think one of those things is leveraging on the size. So we place not just one client with one particular insurer. We place a lot of risk, a lot of our clients to insurance companies. So we have the leverage in terms of negotiation power, in terms of pricing, in terms of terms. As a broker, we do.
So we get better deals lah.
Yeah. So when the insurance company actually see a broker, they don't see us as representing one client. They see the portfolio of clients that we are managing for them. And so obviously in this sense, size do matter in terms of, getting your best deals, terms and conditions. Case in point, we even have clients who literally went direct with an insurer. When went through us, they saw they got better terms than they would have gone direct. I think the other thing more importantly also is what we mentioned just now. We have a wealth of data experience. We look at the trends around, not just happening in Malaysia. What are other people doing across different geographies in Asia? And what are things we can do? We learn from best practices from elsewhere, and we also recommend it to clients that we think is appropriate. So also a wealth of information, data, insight as well, and experience lah. Basically,
And I imagine if you go to directly the principal company, they would just promote that one brand.
We are not product pushers lah. We are solution providers. So that's the key thing lah.
I love that.
If I don't have what you don't have, I get it for you. I don't represent an insurer. I represent everyone in the market. I will find something for you. Your KPI is my KPI lah, basically. So I'm like still speech here, right? So basically, your KPI is mine.
There you go. That is why we buy insurance through a broker. So if you want more information, you can visit their website at www.marsh.com and click Malaysia. Then you will find the Malaysia punya contact details. Thank you so much, Mr. Ho,
My
again for
pleasure.
coming in. It has been lovely. Learn a lot of new things, especially that one line, the cost of doing nothing is even more expensive. Huh? Thank you everybody for watching. I will see you guys another time. Please remember to share, like, comment, and subscribe